Welcome, everyone, and happy Social Work Month. The theme this year, Bringing Change to Life, recognizes and celebrates the difference social workers make in the lives of people, families, and communities across the country and in our province of Newfoundland and Labrador. My name is Annette Johns, and I am the Associate Director of Policy and Practice with the Newfoundland and Labrador Association of Social Workers. I have the honor of being the moderator for today's education event titled, Is the Bucket Half Full or Half Empty? Examining the mental health of children and adolescents today. Regardless of your area of practice, this topic is certainly very timely and relevant to us all. Anxiety issues in children is something we are constantly hearing about, and according to the Mental Health Commission of Canada, 50% of mental disorders develop by the age of 14. Social workers are at the forefront of this work. As one of the largest providers of mental health services in our province, social workers bring extensive knowledge, skills, and expertise to their work with children and youth, and it is exciting that we have two social workers leading this presentation today. This webinar is a collaboration between the Newfoundland and Labrador Association of Social Workers and the Canadian Association of Social Workers. It is exciting to note that we have hundreds of social workers from across Newfoundland and Labrador and throughout Canada tuning in today. The webinar presentation will be approximately 75 minutes, followed by a 15-minute question and answer period that I will moderate. Please send in your questions throughout the presentation, and I'll keep track of them. Only myself and the presenters will see the questions. All of the housekeeping details you need, like how to access the recording, where to download the slides, and how to get your certificate of attendance, are all included in the housekeeping widget that popped up when you first logged on. I now want to introduce our speakers, and I'm just briefly going to introduce them because their full bios are available on the site when you logged in. Hazel Russell is a clinical social worker with child and adolescent mental health and addictions, outpatient psychiatry, located in the Janeway Hospital. She has both a bachelor and an MSW from a bachelor degree in social work and an MSW degree in social work from Memorial University. June Kirkland-Smith is a social worker with the Janeway Lifestyle Program, and her permanent position is Clinical Practice Coordinator with Central Intake Eastern Health. June also received her master's and bachelor's degrees in social work from Memorial University. And I'm pleased to be joined by these two experienced social workers today who both have a wealth of experience in the field of mental health and addictions. So without further ado, and like I said, you can read the full bios on the website, I will now pass things over to Hazel and June to begin the presentation, with June speaking first.
Good afternoon, everybody. We'll be speaking today in general terms on the trends noticed in the mental health field within our practice area and within the recent research, with no particular emphasis on any particular subgroup. Some of our observations or comments that we make today may be slightly sensitive and sometimes not always considered to be popular. However, we do ask you to keep an open mind in hearing what it is that we have to say as we report to you the various experiences that we've had. We believe that parents, kids, and professionals are doing the best that they can with the skills and knowledge that they have, and that sometimes it takes a little bit of time to work harder and do a bit better. So the outline for today involves looking at societal shifts. We'll be examining how children and teens are raised by parents and treated within society. Under societal shifts, we will look at popular parenting beliefs and practices and the noted results of these particular beliefs and practices. We'll be looking at mental health trends across the country based on research and the trends that we've also experienced in our local practice in Newfoundland and Labrador. By trends, we mean that the types of mental health needs and experiences reported by children and teens. We'll delineate the difference between mental health and well-being and mental illness as it's diagnosed in the DSM. Looking as well, we will talk about anxiety and poor coping and differentiate anxiety as it relates to the DSM and whether or not a lot of what we're seeing is actually poor coping. Most importantly, we're going to talk a little bit about how social workers can assist children, teens, and families that present to us to cope with the problems that they're having and live an optimal life.
All right, so we are going to get ourselves started with the title of the slide says every generation blames the one before us. We're not actually looking at blaming, but we think to understand the generation that we're currently dealing with, we need to consider the cohorts that have come before us. So these are just the classic terms that are attached to the cohorts. So if you look at the baby boomer generation, 1946 to 64, this was our post-war generation. This is when the seeds around individuality started. So we had a focus away from the greater good and a little bit of a focus more on individual rights. So we're looking at a free-spirited society back at the baby boomer generation, which will be significant to the generation that we are now seeing as young people and children and adolescents. Our next generation, the Generation X, that's 65 to 79. This is when we saw the two-parent income, the use of daycares. We looked at quality versus quantity around child care practices. And then we move into the millennials, our 1980 to 94. So this generation is what's often referred to as the me generation. This was when self-esteem movement, which we'll talk about in a little while, came to the forefront for this generation. This is when parents were seen more as partners. So the millennial generation does get some flack in the media and in publications for being this me generation. Then we move to the generation that we are seeing now as children and adolescents, 1995 to 2012, is just recently been labeled the iGen, so the I generation, internet generation, which basically means that this is the generation that has grown up with technology. That term recently became coined by Dr. Jean Twenge, who we'll speak about in just a little while. The significant part of the I generation is that we move technology away from productivity to connectivity. So our presentation is going to speak to this I generation. But before we speak about the I generation, we need to understand, I'm not the best with technology, so okay. So in order to understand our I generation, we need to look at the parents of the I generation. The parents of the I generation would be the Generation X. So when we're looking at Generation X, some of the significant things around Generation X is that this was the generation that would have been teenagers in the 1980s. So there were some significant events that happened in the 1980s that have made a significant influence to what we're seeing today and what we would classify as more of a fear-based society. So around physical safety, there were some things that happened in the early 80s in particular. In 1981, we had the abduction of a child, Adam Walsh. And for people who are familiar, that is the son of John Walsh of America's Most Wanted. So he hosts that television program. Significance of the abduction and killing of 6-year-old Adam Walsh wasn't that it was the first abduction. It was actually more about the publication around the abduction, and it set the stage for what became more of a fear-based society. So 2 years later, in 1983, there was a made-for-TV movie called Adam that was viewed by 38 million people across the United States, and we had this whole idea of stranger danger became implemented into society at the time. In August of 2016, Time magazine actually did an article entitled "The U.S. is Still Dealing with the Murder of Adam Walsh," and the author of that article says that it created a nation of petrified kids and paranoid parents. What we know now and what we knew back then was that the risk of harm to children is far greater by people that they know as opposed to strangers. Okay, so if we fast forward then to what we're seeing today, some would say, have we gone too far with respect to the physical safety? So that's just a quick slide to look at that. Right, so emotional safety. Another significant event that was happening around the same time was this focus on the emotional well-being of children. In the 1980s, there was a result of analysis for studies that were done in the 60s and 70s around positive outcomes in adulthood. And so the positive outcomes in adulthood reflected back to self-esteem in childhood. So there were a number of research articles that were looking at the connection between the two. The analysis of the data occurred in the 1980s, and the analysis showed at that time that there was a strong connection between positive self-esteem in childhood, positive outcomes in adulthood when it came to things like educational achievement, happiness, success. So parents and society were given the message that we needed to praise children. So that praise happened within the home. We had the messages that children needed to be told that they're special, that they're the best. So we had a building of the self-esteem. Parents were told that it was their responsibility to build that self-esteem. We also saw that creep into the school systems, and there were some changes that happened in the school system to also support self-esteem. So everyone was given ribbons instead of first place, second place. What happened in 2006 was that the research was re-examined and the secondary analysis completed. Of the 15,000 published research articles in relation to self-esteem and positive outcomes, there were two things that became significant. So of the 15,000 articles, only 200 of those were said to have met the criteria for scientific and academic vigor. The other significant thing that happened was that in 2006, it showed that it wasn't that the positive self-esteem of children created positive outcomes. It was that the adults who were able to achieve their goals and have fulfilling, satisfying lives actually had higher self-esteem. So that correlation was actually reversed. But now we had already started a generation, many generations, where some people would argue that the self-esteem may have been taken too far. And just because we are going to show you what happens sometimes when we look at whether we've taken things too far around this focus on self-esteem. So we're going to look at this highly accredited family of The Simpsons.
Getting your child established on the path to success isn't easy. I was driving my daughter from her falconry tournament to lute class when she turned to me and asked, which is Mandarin for, how do you do it? She and I are learning Mandarin. The answer? Positive reinforcement. In a recent study, this mouse was denied food whenever he failed to find his way through a maze. The mouse ended up dying of low self-esteem.
I had a nightmare where that happened to Bart, but I never told you about it.
I love it when you don't tell me things.
This mouse was given food whether he got through the maze or not, and this fall, he'll be in a lab at Harvard. Low self-esteem can cripple your child's chances of success. The cure? Praise. Praise they can hold in their hands. Certificates, ribbons, and yes, even trophies.
Trophies. So that's the easy answer.
If Ralphie's shelf says he's a winner, then he'll be one. And Mo yells a third thing to feel part of the group.
Yes, trophies. That's what Bart needs. This is how we save him.
Give Bart a trophy? What for? Most boogers wiped on the
So,
bedroom
in
wall.
speaking about the generation, we would certainly be negligent if we didn't address the role of technology in people's lives. While we know the benefits of technology are absolutely countless, we also believe that the excessive use of technology has created detrimental impacts on the mental health of children and youth. If you poll any group of helping professionals, parents, or otherwise, most people would say that one of the biggest influences on children and youth today would be technology. This is an ongoing issue with the Janeway Lifestyle Program, where families raise as a major issue for them how to manage technology and their children. So when we talk about technology, we want to look at the impact of this technology on kids. First of all, we know that Canadian children are spending on average about 7.5 hours a day on screen time. This would include TV, cell phone, tablets, and video games, mostly video games. And it is an astronomical amount of time, but it is accurate and is reflected right across the country. The average amount of screen time that we actually recommend for children under 2 is 0. For children 2 to 5 is just an hour a day, and that's usually doing some kind of an interactive game or with a parent so that the kids are not just kind of in the corner zoning out. And for kids older than 6 and adults as well, it's recommended that the average amount of screen time to maintain a healthy lifestyle is just 2 hours a day. So many of us are exceeding this amount of screen time. We know that related to screen time, we are seeing a lot of children with this sense of instant gratification. So pressing a button on a screen or sliding your finger or whatever can give you instant access to information, a quick result, that kind of thing. And we know that when children are removed from these kinds of devices, the slow routine of everyday life doesn't necessarily measure up. So waiting in line, driving in a car, simply doing something like brushing your teeth or solving a basic problem becomes a really boring and unbearable kind of issue for a child. So with the inability of being able to tolerate the boredom, we see a lot of behavioral issues and an increased inability to cope with the less popular feelings of being bored or being alone or being unstimulated. We know that instant gratification is something that can be harmful to children when they don't learn how to wait, because if we look back in the 1970s, all the research that was done that showed us that having a delayed gratification or the ability to delay your gratification was very much correlated with higher rates of success in employment, higher rates of happiness, and that kind of thing. So that would be back with, if you think about like your courses that you did where you learned about like the marshmallow test and the cookie test and all that kind of thing, and kids were having to wait to get a small reward or a bigger reward. And then they were followed up like 40 years later or something like that. The other thing we're seeing is that through technology we have immediate access to information. And this is absolutely a beneficial thing. And it certainly beats, flicking through a Rolodex or looking up the Dewey Decimal System and having to walk 5 floors up to the library, pull out a book, and see whether or not it's the right one. We can now learn something or anything that we want to learn very quickly. And that is amazing. However, children are accessing information online that they have maybe even the cognitive ability to manage, but not the emotional maturity to manage. So it can cause a lot of stress and anxiety among children. The other effect that we're seeing is a term called digital heroin. And this basically refers to the sensation that people are getting by having large amounts of time using screens. So anything under 2 hours is generally considered good, or not necessarily good, but certainly harmless or helpful. But once you exceed even moderate levels through the day, especially anything over 5 hours, you are dealing with a situation whereby the components of your brain that's fired off when using heroin or high doses of sugar and things like that actually get fired off in the same way by excessive amounts of screen time. So you have children who are really having a difficult time removing themselves from their screens and fitting in and doing normal things in everyday life. We have seen many children who are avoiding social activities at the expense of, they're using screen time over social activities. And we have seen children who are avoiding in their pants, much like you see in the casino type scenario where people can buy tens. So they don't have to leave a machine. We have seen many children who are avoiding in their pants in order not to have to go to the washroom while they're gaming and doing things online. The other detrimental impact that we've seen significantly is the impact on sleep. We know that the more screen time you have during the day, the less your melatonin, which is the hormone released from your body to help you fall asleep, is being produced at the right amount of time. Melatonin obviously affects your circadian rhythm and your ability to kind of fall asleep and stay asleep. And children who are using screen time, particularly an hour or two before bed, are having the blue light that's emitted from screens is significantly affecting their ability to fall asleep. So if you have a group of children who are constantly fatigued and tired, up all night on their screens, receiving texts through the night, having their phones charging in the room but getting up when the light is flashing or when it's beeping or whatever, then you have a significant impact on their ability to sleep well. There's a huge impact on children's physical activity, and there's a major increase in the amount of sedentary time that people are having across the country. So we know that children should be at least getting about an hour of moderate to vigorous activity every day, and younger children even more so, and we're seeing a big drop in the amount of physical activity that children are getting. And that physical activity could either be organized or it could just be recreational play or leisure activity. There's an impact on social activity as well. So research is showing, and our experience is telling us, that children are, at the expense of their social time, they're actually going to less parties, going less to the mall to kind of hang out or shop or buy things or hang out at a food court, less to dances, and less socializing with kids, connecting in cafes or even in a car driving around or whatever. There's less time being spent doing those kinds of social activities that many normal children or teenagers do. Now, while some people might look at that and say that's awesome because there's fewer accidents and fewer kids hanging out at the mall getting into trouble and that kind of thing, we also know that by eliminating and reducing these amounts of social kinds of interactions that children need, they're lessening their opportunity in life. So as they move on and they're faced with normal challenges like solving a problem, applying for a job, making an order in a restaurant, trying to apply for your driver's permit, asking someone to the grad, all these kinds of making an order in a restaurant, trying to apply for your driver's permit, asking someone to the grad, all these kinds of things present exceedingly high levels of anxiety and stress and upset, and they're not equipped with the skills to do it. So those are that it can be overstimulated or hyper-aroused from even moderate but regular amounts of screen time. So we find that the children end up acting up, and the brain, because the brain is chronically stressed, and that when they act up, their symptoms look like inattention, behavior problems, anxiety, mental health issues, when in actual fact they're hyper-aroused or they're hyper-stimulated from just simply being online or gaming or whatever that kind of thing is for excessive amounts of time. We've also seen many people have such severe tantrums and things like that parents are kind of whipping them off to ER to see that, that they've had some kind of major meltdown type thing based on their excessive use of technology. So, so those are just some of the things that we wanted to mention with regard to technology. Again, we don't want to come across as being totally critical of the value of technology, because we all know it's amazing and there are many things about it. What we are suggesting is that moderation would be more helpful.
All right, so when we talk about the links that have been made early on in the 80s between safety, physical safety, emotional safety, and now we're talking about this new generation being raised on technology. We wanted to introduce some concepts from this book. It's called The iGen, written by Dr. Jean Twenge, who's a research psychologist. And this is a quote that we thought really made sense to some of the messages that we want to provide today. So we're talking about this whole focus on the world being an unsafe world, unsafe physically, unsafe emotionally, and how that has affected this generation. So there's a quote at the end of the book, which we have here. Dr. Twenge says they are speaking to the children and adolescents of today, that they are both the most physically safest generation and the most mentally fragile. So they are the most physically safest generation if we look at statistics around accidents, accidental death, homicide rates. All of those things have greatly been reduced. At the same time, we have what's been referred to as emotionally fragile, sensitivity issues in relation to children and adolescents. There's also a book that was released a couple of years ago. Dr. Leonard Sachs released a book called The Collapse of Parenting. His main message is exactly the same, that there are this idea of being fragile children when it comes to emotional. So we're going to talk a little bit more about what has led to some of those issues. And basically what Dr. Twenge references a lot of things back to is 2007 and the introduction of the iPhone in particular.
So some of the research that's been correlated with the introduction of the iPhone, again, not a criticism, but just an observation, is that since that introduction, there has been an increase, a significant increase in children reporting higher rates of feeling lonely. And frequently what happens is that while children are connecting online and things like that, they're also learning through social media of events where they've been left out, especially girls, and they tend to judge more harshly their own levels of happiness because on social media we see things like lots of smiling faces and BFF forever and happy emojis and all those kinds of things. And you know, if you look at people's Facebook and Snapchat and things like that, everything looks like they're living an absolutely wonderful, blissful life. So when kids actually spend more time together in person, connecting, they realize that a lot of their peers are having the same struggles and the same kinds of challenges and worries and things like that their friends have. So it's not all about bliss and happiness. And then they feel more normal if they spend more time with them and see that, as opposed to just looking online. The other thing that's been reported as well is a decrease in the amount of time that children are hanging out together. So we are very much social beings, and it is important for people to have friendships to develop and grow. And we know that children who are involved in things like sports and friendships and activities generally report higher levels of happiness and satisfaction and mental well-being. And children who are more isolated, which is what's happening, is that people are staying home, going on their phone, hiding under their blankets with their tablets and things like that, and just spending all their time scrolling and looking and that kind of thing, and not connecting necessarily in real life.
So we're going to look now at what the impact has been on some of these societal changes. So we're going to look at it in relation to parents, and we're going to look at it in relation to children and teens. So if we're saying the messages that parents are getting is that this is an unsafe world and that it's your responsibility as a parent to boost your child's self-esteem while at the same time protecting them. So huge responsibilities being placed on parents. So what we find is that parents tend to be what are now classified as being overprotective and over-involved because they're struggling with how do you protect your child and build the self-esteem at the same time. Again, those messages that were set really early back in the 80s. So we are finding that this is a trend that we're seeing among the parents of children and adolescents that we're seeing. There's some rescuing behaviors, what we classify as rescuing. That's often about not allowing natural consequences to play themselves out. And some of that is related to if they allow natural consequences to play themselves out, then children's self-esteem might be affected. So we're still having those connections being made today that were set back in the 80s. We also have this idea that parents need to fix children's problems. So we're seeing parents being over-involved to the degree that they're texting maybe friends, boyfriends, girlfriends, being overly involved and familiar with the things that are happening with their children. We had some terms coined like the snowplow parent. So a snowplow parent would be the parent who's just going to push all the obstacles out of the way so that their child can succeed. You don't want your child to experience any upset or failure. There are also snowplow parents would also be the parents who might be approaching coaches, teachers, and trying to resolve issues for children and teenagers. People would be more than familiar with the term helicopter parent. It was actually coined in the 1990s as a result of an influx of parents of university students. So there were university professors that were noticing that when campus was opening, it wasn't just parents coming to settle their young people in. They were actually staying around. They were helping them do course selection. They were being really what we would consider over-involved. Helicopter parents are basically the parents that hover, and they're typically hovering because of their own anxiety. So what we're seeing as a result is that young people are sometimes being given lots of decision-making options, sometimes age-appropriate, sometimes developmentally appropriate. We have situations in, say, maybe divorce and separation where very young children are being asked not just for their input in living arrangements, but to be given the right to make those decisions, which is concerning. Dr. Leonard Sachs, the book that I mentioned earlier around the collapse of parenting, he opens his book with an example of a 10-year-old who, after being brought to view 3 different schools, is given the decision-making ability by the parents to say, which school would you like to choose? A 10-year-old is going to choose a school that they feel something happened in that school that was interesting and inviting to them. In this case, it was a young girl who had another student smile at her. So she's making a decision about a school because of that, when the parents had actually selected a different school in their independent decision-making, but went with the decision that their 10-year-old made because they didn't want to force their 10-year-old to go to a school that they didn't actually make the decision about. So there are situations like that where it's developmentally inappropriate to make the decisions. Again, we're not saying not to have any input, but you also have young people then who lack the ability to be able to problem solve. So if we have over-involved, overprotective parents, then they're also making the problem solving is happening by the parents and not the children and teenagers. So they're not given the opportunity to be able to do that. And if you don't have the opportunity to build problem-solving skills, because they are skills, then you lack that ability. So what happens for the most part is that children and teens who are in those situations will make decisions based on what they feel like doing. And if you grow up in situations where you only do what you feel like doing, then you're going to grow up into a world that's going to be really difficult, because if you imagine if you only did, even as adults, if we only did what we felt like doing, how many people would show up to work every day? How many people would do some really difficult things that we have to do every day? So the thing that has allowed some of this over-involvement, over-protectiveness, and decision-making, problem-solving to continue has been related to technology. So the cell phone has often been referred to as the longest umbilical cord in the world. So it allows that constant 24/7 connection. What we're also seeing in parents is parents are feeling less confident in their ability to parent. So if you consider, how do you know how to parent? How do you know how to be an effective parent? So there's basically 2 ways. One is through the exposure that you had from your own parent. that modeling, whether you want to do the things that your parent did or whether you definitely don't want to do the things that your parent did. Either way, you've been exposed to parenting. The other way is to educate yourself and make some informed decisions. The issue with this generation and the parents and the children and adolescents is that technology wasn't a thing back when this set of parents were children. So they don't have the exposure to it. They don't have any opportunity for modeling when it comes specifically to technology. So, of course, to look for some of those answers in this information overload society, professional-based society, they are going to actually gravitate to technology itself. So if we consider that, we're going to go do, if we were to pull up an internet search right now and we went into, say, Indigo Chapter's website, you punch in parenting, you're going to end up with 13,000 results. If you go into Amazon.ca and you put in parenting, you will end up with 201,000 results. And if you want to check out the American site, Amazon.com, you will get over 236,000 results. A lot of the information will contradict each other. So you will get books on how to parent if you want this type of child, and you'll find another book that will tell you absolutely don't do that. So there's lots of conflicting information, so we wonder why parents are confused. Prior to this information overload, we had just the one book on parenting for a very, very long time. It was written back in 1946 and has 9 editions, and it was written by Dr. Benjamin Spock, a pediatrician. The title of the book was called A Common Sense Book of Baby and Child Care. So it was basically the Bible for parenting for a very, very long time, and it had one very simple, consistent message, and that message was, trust yourself. You know more than you think you know. So it actually built on the confidence in parenting. We don't have that same degree of confidence anymore. What we're seeing at the same time is that young people are feeling less confident in their ability to cope. So if teens and children are shielded from uncomfortable, negative, and intense emotions, again, typically related to self-esteem, it actually compromises their ability to tolerate it when it does happen. So what we end up with on both ends are parents and children and teens who are seeking immediate relief. The number one reason for referral to the mental health system is anxiety-based. So June spoke about this whole idea around delayed gratification. So if we are looking, we're in a fast-paced society. We have media images everywhere that's telling us that there are quick fixes, and children and teens are going to look for some of those quick fixes because that's the messages that they're given. Parents are going to want quick fixes because that's the messages that we're given. The media is portraying images that everybody should be happy, and if you're not happy, there's a pill for every ill. And we end up with quick fixes through things such as self-harm, drugs, alcohol. We're looking for escape from some of these really uncomfortable emotions. When it comes to seeking services, we're seeing, we'll speak a little bit later about that, but we see increased presentation to emerge. We're looking for that quickness. We also see a significant increase right across the country in the dispensing of SSRIs, which are the number one treatments, medication for anxiety and depression. So the Journal of Psychiatry, Canadian Journal of Psychiatry, released a study last year that looked at between 2010 and 2013 an increase for the pediatric population right across Canada. There was an increase of 63% in the dispensing of SSRIs for that population. I think we have people online from BC. BC actually has the lowest rate of dispensing right now. Newfoundland has the highest. All right, so those are some of the things that we are seeing when it comes to direct impacts around some of the challenges that we're having. So we switch gears a little bit and talk about, in relation to that, what is it that we're seeing that is related to mental health, and what is it that we're seeing that's related to mental illness. This is one of the simplest ways of describing what the difference is between mental health and mental illness. So if we consider mental health, generally mental health is your ability to be able to manage the day-to-day stressors in your life. It is all-encompassing, so it's your overall well-being. It also includes your physical health. A mental illness is actually a diagnosable condition under DSM, Diagnostic Statistical Manual, for mental disorders. And so that criteria there looks at the duration, the intensity of symptoms, and the impairment of the symptoms. So if we look at each of those is on a continuum, let's look at poor mental health first. So at the bottom here, we have poor mental health and going up to optimal mental health. So somebody with optimal mental health would be taking very good care of themselves. So this would be somebody who's eating properly, sleeping properly, managing their stressors properly, exercising, getting enough sleep. All of those things are combined and part of problem solving. All of those things are about your mental health. Mental illness continuum. You could have no symptoms of a mental illness, or you could have a pretty serious mental illness. And when we speak of pretty serious mental illness on that continuum, oftentimes people think in relation to bipolar, schizophrenia. But you can also have an anxiety disorder right across that spectrum. So you can have somebody with no symptoms of that. You can have a mild anxiety disorder. It can be in the mid-range, or you can have pretty serious anxiety disorder. When we look at this, our goal is always to have people in the upper quadrants. So we're looking at how to optimize mental health. If you, for example, have somebody with a bipolar disorder, then we might not, we can't necessarily move further down on the mental illness part, but we can absolutely move on the mental health part, how they're managing that mental illness. Our goal in therapy is always staying up in those upper quadrants. What we're finding in our practices is that we have a high percentage of people who are actually in the lower right quadrant. So not necessarily may not be presenting with a mental illness, but have absolute issues with their mental health. And so the mental health is in relation to their coping.
So just to expand further on what Hazel was saying, some of the trends that we're seeing as well with regard to poor coping are, well, on a positive note, first of all, the trends in young people, one thing that we see that's very positive is that children and teens are super accepting and embracing of many different lifestyles these days, way more than previous generations. Where the I generation is much more open to sexual expression, personal expression of identity, that kind of thing. So that's been a very good thing. We are seeing increased rates of self-harm, and we know that self-harm is a deliberate and repetitive, frequently, self-inflicted harm to your body without the conscious intent of suicide. So we're not talking about suicide attempts, we're talking about self-harm, which is completely different. Self-harm is not a diagnosis in the DSM. It is deemed a behavior and not a mental illness. It is up for current review. It's being reviewed and considered and things like that. But the bottom line is that it's considered a behavior or a coping strategy for kids and teens. The adolescent population in particular has seen a growing rate of self-harm globally. So professionals right across the world are dealing more and more with this issue with young people, to the point now where self-harming behavior is so common in the adolescent population that in current society we're often looking at it as experimental, not atypical, no different really than trying pot or smoking or using alcohol or anything like that. Most kids who try self-harm will not continue, but nevertheless we are seeing high rates of self-harm. And, of course, because parents are worried, as Hazel talked about, they have less confidence in their parenting and more worries about the mental health of their children in general. They're frequently going to ER and to clinic visits and seeking immediate services and things like that for acts of self-harm that kids are using. We're seeing an increased use of marijuana, and unfortunately, there's been a trend in the number of induced weed or drug use induced psychosis. We don't know if the psychosis that we're seeing in children and teenagers is as a result of excessive uses of marijuana or if it's associated with the chemicals that are mixed in with the marijuana. So possibly most likely the second, the latter, but again, we are not sure about that. And either way, we're seeing an increase in the number of young teenagers who are presenting with a psychosis that can take, can take a period of time to resolve, sometimes weeks, and sometimes they have been set then on the course of developing future, more serious difficulties. For others, it's resolved in a shorter period of time. The sleep deprivation, I have talked a bit about that already, but we do know that, just so that you know as a kind of a background, children who are 5 to 12-ish need about 10 to 12 hours of sleep. Kids who are 13 need about 9, and kids who are 14 to 17 need about 8 to 10 hours. So that's a lot of sleep, and that's sleep. That's not like I'm going to settle down and take an hour to do stuff before I actually go to sleep. That's pure sleep. So if your routine, of reading stories or doing whatever beforehand takes you half an hour, that has to be added on. And really only about 1 to 3% of people, and that would be adults, require less than the typical amount of sleep that most of us need. So there's a very small portion of the population who don't need the regular amount of sleep. But the bottom line is that most of us do, and particularly teenagers and children need the required number of hours of sleep in order to function properly. Once they get into having a lack of sleep, there's an immediate effect on their mental and emotional states. Over a long period of time, poor sleep contributes to a whole range of health issues, both physical and mental. Even short-term, people have issues with memory, emotional regulation. They overreact. In Newfoundland, we call it people being crooked or moody or whatever. So basically, you get unwarranted emotional outbursts and crankiness and anxiety and things like that. So if you take that scenario and you put it over a 5 or 6 month period or a long period of time where somebody is sleep deprived, then you start seeing things that manifest themselves as a mental health issue when in actual fact it's related to a very basic fundamental thing that we need, which is sleep. So it's really important as social workers that when we do our assessments and we're talking to children and teenagers and families about mental health presentations, coping skills and things like that, that we absolutely assess sleep hygiene with children and youth. We also know on a more extreme level that anyone who is completely deprived of sleep for very long periods of time, hours and hours on end, that their symptoms can mimic things like psychosis or schizophrenia or whatever. And we also know that poor sleep is related to increased eating of foods that are generally considered what we call red light foods or unhealthy foods, so high carb, high salt, high sugar. And there's an association between poor sleep and weight gain. And then that begins, once again, a vicious cycle of problems, because when you get weight gain and obesity and things like that, we know that a very high percentage of children with obesity, upwards to 70%, experience weight-based bullying. So again, everything with regard to lifestyle is completely connected to each other thing. The last thing I wanted to talk about is the increase in presentation to emergency departments. And what we have seen nationally is that from 2006-7-ish to 2014-15-ish, nationally the number of visits to ER have gone up by 50% for mental health reasons. Locally in Newfoundland, we have seen an increase of 77%. The highest rate of increase for children is among the age group of 10 to 14 locally, so we're not sure if we can extrapolate that to the whole country, but it's quite likely that it would fit as well. So what happens is that everything fits in terms of what Hazel has been talking about. Decrease parent confidence, increase awareness of mental health issues and things like that, which is an excellent thing, and this is the sensitive part I'm talking about. It is an amazing and excellent thing to talk about mental health and mental illness and all those kinds of things, but we have to be very cautious about over-endorsing and over-pathologizing normal experiences, and that's the thing we're worried about. So the other thing that we see is that increased ER visits are associated with resource issues. So people are saying, well, if I got to wait a year on a wait list to see a psychiatrist or a therapist or something, I'm just going to go to ER and I'm going to get the service I need right away. So they're kind of skipping the line or, you know, doing what they feel they need to do in order to get the service. And again, that's not a judgment because you can't blame people who want to get services for their children. It is absolutely understandable that people will do whatever they need to do in order to enlist the service of something that will help their child. So everything's done with a good intention. The other thing that we're seeing as well is policy changes within group homes and government-regulated home care situations whereby when children or teenagers voice concern about low mood or self-harm or a suicidal thought or something like that, staff are instructed to immediately have them assessed by ER. So, again, people are trying to be prudent, but we also live in an age of increased liability, and people are afraid of missing something. So we have that whole scenario as well. In all of this, while all the visits to ER are on the increase and people are seeking, we definitely have more help-seeking kinds of behaviors among families and children and teens. According to Canadian research, the Canadian Institute of Health Information, there is about no change in the amount of mental illnesses that have been diagnosed. So across the country, there's no necessarily increase in the prevalence of mental disorders, but there is an increase in mental health issues and presentations for seeking for help. The only slight increase which has come about with regard to mental disorders would be ADHD, which there appears to be a bit of an increase in. And the other notable change is that children are presenting earlier, with an earlier onset of mental illness and with greater intensity. So thankfully, so maybe that's because we're catching it earlier. It's kind of difficult to say which came first. So that's the trend across the country. I'm going to show you a little video now of a child psychiatrist in Halifax, Dr. Stan Kuchar. And he's going to
Hi, I'm Dr. Stan Kuchar, the Sun Life Financial Chair in Adolescent Mental Health at IWK Health Center in Dalhousie University. Thanks for taking the time to listen. I'm going to be talking a little bit about how can we differentiate a bad hair week from a mental disorder. It's a really important issue. But before I get onto that, I just want to talk about a phenomenon that we're seeing, which is getting to be more prevalent and more concerning, and that is the building relationship between the normal stresses of everyday life and the idea that any problem is a mental health problem. That's just not correct. You know, sometimes there are things that happen in life which give us negative emotions and give us pause and give us challenges. That's normal. That is not a mental disorder. We don't need to medicalize things. I hear kids talking, oh my gosh, I've been so traumatized. Jane wore the same colored dress that I wore. I'm traumatized. They're not traumatized. They're having a social challenge. I hear, my gosh, my OCD is acting up. They're not talking about obsessive compulsive disorder. They're talking about, they're very meticulous, and that's a good thing. They're talking, oh, I'm so schizophrenic. They don't mean that they have schizophrenia. They mean that they are being pulled in different directions at the same time. Recently heard a young man talk about how depressed he was because he didn't make the basketball team at school. He wasn't depressed as in depression. He was unhappy, demoralized, disgruntled. Michael Jordan was cut from his high school basketball team. He didn't become depressed, he became a better basketball player. So we have to stop this social creep of medicalizing real life. Life has its challenges, life has its difficulties. Life has lots of bad hair weeks. It's got a lot of bad hair days, and sometimes it has bad hair months. But you know what? That's not a mental illness. It's a bad hair month. And, you know, there is a great quote from Winston Churchill that I really like. I'll share that with you. It says, when you're going through hell, keep going. Just because things are stressful, just because life is challenging, it doesn't mean you have a mental disorder. It means you have a challenge and stressor in your life that you have to deal with. Bring in your family, bring in your friends, and deal with it and work on it. So how do we tell the difference between a bad hair week and a mental disorder? Well, you know, a mental disorder has very specific signs and symptoms that cause substantial functional impairment that's persistent over time, and that responds to standardized treatments that have been evidence-based and we know are likely to help. A bad hair week is a bad hair week. There's a big difference. Thanks for listening. I'm Dr. Stan Kuchar.
Okay, so we're just going to show you a little quote. It says, the tough emotions are part of our contract with life. You don't have to have a meaningful career or raise a family or leave the world a better place without stress and discomfort. Discomfort is the price of admission to a meaningful life.
And speaking about discomfort, we're going to just talk briefly about anxiety versus poor coping. So hopefully we've set the stage a little bit in relation to that already. Right. So going to just examine very basically what anxiety looks like. So again, if we consider back to the quadrant, anxiety can be anywhere on that horizontal. So we're looking at having no signs of mental illness versus a full-fledged, pretty significant mental illness disorder. But anxiety can be anywhere on that spectrum. So the thing that happens with anxiety, the thing that makes it very uncomfortable for a lot of people is the body response to anxiety. So if we're looking at it from a CBT perspective, cognitive behavior, so we're looking at how the body responds. There's an activation of the stress response when anxiety is present. So we're looking at cortisol being dumped into the body, and then the body responds. So there's an activation of your system. You find typically everything in the body revs up. So you have your heart rate might increase, your blood pressure might increase. We all experience the stress response very similar. Some people at its extreme would refer to it like the fight or flight response. If we tease apart cognitively what's happening in anxiety, you'll often hear these what-if phrases. Anxiety is never about something that's happening in the moment. Anxiety is always about the perceived threat of something that might happen in the future. So anxiety is always future-directed. And if you speak to young people and teenagers who struggle with anxiety, you'll see they get caught in this cyclical thinking, and it's always, what if this happens, and what if something else happens, and what if something else happens? So this storyline that they get stuck on is always future-directed. So you can always identify if somebody is starting questions with the what if, it's typically anxiety-based questions. So the behavior, any intense emotion that registers in your body, there's an automatic behavioral urge that's associated with whatever emotion it is that you're feeling. For anxiety, the automatic urge that you have from a behavior perspective is to avoid the situation where the anxiety is present. Or if you're in the situation and the anxiety is present, your urge is to escape that situation. So if we think of it in relation to school, for example, it would be avoiding school, or if you're in school, leaving school. With anxiety, there's a lot of what we call reassurance-seeking behaviors, again, where the cell phones play a huge part in that. So oftentimes, when we're seeing young people, with anxiety, one of the issues that the parents typically bring up is the amount of text messages that they're receiving from their young person through the run of a day. So if you have young people who struggle with anxiety and or poor coping, they end up sending a lot of text messages in the run of a day to parents because they're looking for that reassurance seeking. Oftentimes when parents raise that as a concern, my first question back to parents is always, how many of those text messages are you responding to? So shifting the focus back to how that's actually being supported based on the response that they're getting. If we look at poor coping and how that's a little bit different, so our anxiety is on that horizontal. Poor coping is actually on the vertical. So poor coping is related to mental health. And you can absolutely have both of them together, which that's when you end up with more concerning behaviors. So if you have an actual disorder plus you struggle with the coping around managing that. The body response in poor coping is very similar. So there's an activation of the stress response again, but it's typically situational. So there's something happening in the moment. And what you find that the thoughts are related to this thing that's happening right now. And so instead of the what if, the things that might happen in the future, it's what now? How do I cope? What do I do? Right? So it can be something as simple, what seems simple to us as, a cell phone not being charged. What do I do now? How do I deal with this? I can't go to school like this. Somebody who didn't, a teenager who don't have their favorite pair of jeans clean to wear to school that day. What you see is an exaggerated response to what should be a typical stressor. What you see behaviorally around poor coping is typically you see impulsivity. And you see what we refer to as reactivity. Reactivity is just that response based on emotion. So if the behavior that's being triggered, let's say it's anger. So the emotional feeling is anger. The urge around the anger is to lash out. So reactivity would be now you're responding to lashing out. So you're not putting the brakes on. You're not making you're trying to numb out the emotion, and you're going to do that by just reacting to whatever emotion it is that's there in that moment. So what we end up with in between these, so what you'll see is that with the poor coping, you're so activated emotionally that you're unable to focus on problem solving. So we look at anxiety as an inability to be able to tolerate the uncertainty of what's going to happen. But when we look at poor coping, it's really about the inability to be able to tolerate a really uncomfortable emotion. So whether it's anxiety or poor coping, either of those, what we do know from a clinical perspective is that exposure is really key with both. So whether this is something diagnosable or not, exposure is significant. And the way that you expose is you build tolerance. So we're talking about we're not talking ever about eliminating anxiety. We're not talking about eliminating stress. We're not talking about eliminating uncomfortable feelings. We're talking about how to build tolerance for it, and you build that tolerance through exposure. If you consider it very similar to physical health. So if you look at mental health, but if you take a step back and consider that from a physical perspective, so if we're looking at physical illness, for example, we wouldn't put somebody in a situation that's completely germ-free all the time and expect them to develop a tolerance to germs and disease. But we actually expose them. We use immunizations for that very reason. So we're exposing our bodies to something where they develop a tolerance to it and develop a resistance to it. So your mental health is exactly the same way. If we don't expose children and teenagers to situations that are uncomfortable and build their capacity, then they don't learn how to tolerate it. There's a short quote there from Helen Keller, which I'm not going to read out because I think we're going to be pressed for time, so we'll just move on.
So we're going to talk about the role of a social worker in dealing with all of this. Most importantly, It's important as social workers that we be able to educate the families, other professionals, and our colleagues on the things that are being presented. So it's important for us to know about the various mental health issues that face people and know the different disorders that people can get. So learning about the characteristics of mental disorders like bipolar, mood disorders, and things like that, and being able to differentiate that from normal kinds of mood variation among kids and teenagers is really important. So reflecting back on the courses that we would have done through our BSWs and things like that on normal development and normal childhood development, it's really important to try to, extract that information from within yourself to help people understand what is normal and when does it become a concern. Validation is obviously key to any social work intervention that we do, and I think that families, given the level of insecurity that we've talked about that families have, parents have, and professionals in many regards, in trying to navigate this whole milieu of mental health difficulties among people. I think validating people's efforts to do well and to be better and to try harder is really important because it leads them on a road to continued success and exploration as opposed to making them feel bad and upset about what they're doing. I think we need to normalize a stress response for people so that when we're working with families and children, I had a 9-year-old the other day where I actually could explain using a diagram all of the various symptoms that occur in your body when you are faced with stress and what is normal when you're stressed and why that happens. The caveman response that my colleague always refers to. So when he understood that, he realized that he wasn't dying and choking and he could breathe and that he was feeling dizzy because he wasn't breathing, and that he had psychomotor agitation because his energy was going toward his limbs so that he could run. So when we put that in perspective and explain it to somebody, it becomes less scary and more understandable. So knowing that whole response is really important. Promoting the proper use of language is pivotal. People are over-pathologizing symptoms and overusing or inappropriately using a lot of language. People are using, I had a child who talked about having social anxiety the other day when she's experiencing the typical kinds of insecurity that teenagers feel when they go to the mall to order their burger or buy a movie ticket or something like that. It's an uncomfortable situation because she hasn't done it that much. So she needs to learn those skills. She does not have social anxiety disorder. She has some normal kinds of discomfort associated with the acquisition of a new skill. So when we promote the proper use of language, and the other one that's very common in a mental health field is this notion and worry of children having bipolar disorder because they're moody. So when you explain the disorder, you explain things like cyclothymia and dysthymia and bipolar and normal emotions. People have a much better understanding of things, and you encourage them to use the proper language, it helps them get a hold on things so that they don't feel so big all the time. Teaching stress management skills, practical coping, and problem-solving skills are all a part of the absolute essence of social work, and helping families learn how to manage their stress as opposed to just react to their stress. So it's more than just taking a bath or something like that. It's learning how to regulate your life, learning how to manage your finances, how to manage your mood, how to manage your homework expectations, all those kinds of things. And teaching them really practical kinds of skills that they can take into their lives every day and use. The other thing that's very important is the reinforcement of a healthy lifestyle. So when we go right back to the basics, the bottom line is that for mental wellness, we all need to sleep well. We need to eat well. We need to be able to move our bodies and exercise so that we're not sitting in a cesspool of negative emotions. And we need to try to feel good about ourselves. So if we look at the basic components of living, like moving your body and exercising, proper nutrition, those kinds of things, we set somebody on a path to cope significantly better than if all those things are out of whack. So when you're doing your assessment, once again, you have to look at really basic things like how is this person sleeping, how are they eating, are they living on food that's not nutritionally beneficial for them, are they getting some exercise or movement, or are they just sitting all day, and that's not a good thing for them. So these are some of the things that social workers can do. Hazel likes to talk a lot about the image of is your bucket full, so she's going to explain a little bit of this in terms of coping.
All right, so this is actually a term borrowed from DBT, dialectical behavior therapy, but we've changed it a little bit in relation to explaining stress and coping. So it is a really neat concept that sticks with parents and it sticks with adolescents around explaining what happens when we're considering stress and coping. So if you consider that everybody has a certain tolerance level already for stress, and if you consider that your tolerance level for stress is like the size of a bucket, so we got all different sizes of buckets here. Size of your bucket is influenced by a lot of things, the least of which would be your temperament. So you're actually born with some of your capacity. Your environment as well will influence it. But all of us have this certain tolerance level when it comes to stress. And if you consider that every stressor in your life is like a drop of water in a bucket, in your bucket, your buckets tend to get full based on the stressors in your life. Things that are stressors are very individual. So it's a stressor for me, not necessarily a stressor for somebody else. At some point, all of our buckets get full, whether it's with little stressors that continue to fill our buckets up, or whether it's one big major stressor that fills our bucket up. At some point, all of us experience having our buckets full. So when your bucket is full, it will overflow. So if you add one more stressor to a bucket that's already full, regardless of what that stressor is, it's going to cause your bucket to overflow. When our buckets overflow, that's when we see a lot of this reactivity. You have these thoughts around, I can't cope, this is unbearable, I can't stand it. You're completely overwhelmed when your bucket's overflowing. So our goal is always to keep the water manageable, the stressors manageable. Because when our stressors are manageable, we can continue to have added stressors. We know that your day, a typical day, is full of all kinds of everyday stressors. So you need to have some capacity there to be able to manage those stressors, but if you go around with your bucket 3/4 or almost full all the time, it's hard to manage even the little stressors day to day. So how do you effectively manage those stressors? So there's a couple of different ways. There's stress management would be from a preventative standpoint. So that's having those holes in the bucket so that you are trying as best you can. That's that balanced lifestyle that June spoke about. So that helps you in a preventative way manage that stress because it prevents you from overflowing. But then we can't always stop our buckets from overflowing. So there's a set of skills that is referred to in dialectical behavior therapy as distress tolerance skills. Those are our survival skills. So they are, when your bucket is overflowing, what are you going to do about it? The reactivity part that's highlighted in the red there means if there are no skills that are put in place to manage it differently, you are going to react based on how you feel. So that's that tendency to be impulsive. That's that tendency to do things in the moment because you can't tolerate this moment any longer. That's what we all feel like when we're overwhelmed. The part of the brain that's in control when that reactivity happens is the older part of the brain, the limbic system. So it's completely emotionally driven. In the blue here, the more cool zone, you have a responsive. So that's the responsiveness is about the planning. So if you can learn to tolerate that distress, which means you're not going to respond immediately to the distress in the moment, you're going to plan to do something differently, then you're going to respond rather than react. So in order to be able to do that, you need to tap into the thinking part of your brain, which you can't do if you're completely overwhelmed. So this is where we come in therapy. We focus on a time when things are calm so that you can make a plan when you are calm and you're able to access your rational brain we make some planning in place so that when you are in those situations where you're completely overwhelmed, you just put the plan in place. So you choose to do something differently. Because what typically happens, especially with adolescents and children as well, is when you're reactive and you do things impulsively, you do things that you regret. So then you create a whole other issue where you have secondary emotions attached to something that you did that you wish you didn't have, that you wish you hadn't done. And so we create a whole host of issues in relation to that. So learning how to slow our bodies down is really significant. And when you're given the option to make decisions, that you can make them at a time when things are calmer, and then you can put those plans in place. It's important. There's a lot of focus on emotional regulation and the ability to calm the body down. Those things are significant and they are important, but we can't lose sight of what the real issue is as well, which is the problem solving. So we can't just be teaching young people how to regulate emotions if we don't also teach them how to problem solve and make good decisions. And we can't protect them from uncomfortable emotions, and we can't make decisions for them.
So given that we've talked about technology so much, we wanted to give you a few ideas as well, or make a few comments about limits on technology. We're big proponents of limiting technology and helping families have no cell phone zones. Particularly, would talk about that in terms of the meal and the supper time table. We know that the research has shown us over and over again that the more meals that families have together, that the greater the chances of reducing behavioral issues, improving academic performances, building better connections and that kind of thing, and that when people are together at the supper time table and they're distracted by their phone, they're not connecting in the same way. So as social workers, it's really important to encourage families to lose the cell phone at the supper table so that we can continue to have family meals as a meaningful experience. We also talk a lot about how important it is to have the phones out of the bedrooms in the nighttime and have some kind of family charging station or a setup whereby phones and devices are held away from the bedrooms so that there's no emission of light, no beeps, no buzzes, no anything that's distracting people, and tempting kids and teenagers to get up and check it. A lot of kids will say, well, you know, I needed to set off my alarm, but you could always go back to, I guess, an old-fashioned alarm clock or something like that, and use it instead of that, because the temptation is so great for them to be checking and looking at what their friends are doing and that kind of thing. So we really encourage people to limit technology use and to try to have times when people are connecting face-to-face, so that when you're going out to supper, or you're going to a party, or you're going with somebody, that you spend more time connecting as opposed and looking at each other and reading cues as opposed to looking down at Snapchat or whatever.
We had to take the opportunity just to put this in there. I had the experience of visiting Japan last summer, and this is what you will find in most Japanese restaurants. So real focus on no cell zones, and this is what you will find in most Canadian restaurants. So we're actually promoting Wi-Fi. So it's interesting if you link it back to the results of the iGen book when it speaks to the high degrees of loneliness. And if you ask young people, they will tell you, a lot of young people we see will say they feel alone even in a crowd. If you are socially connected on your phone, even when you're in a crowd, you will absolutely feel alone. So that's significant for sure, and then we're promoting that as a society to say it's not only okay, it's actually encouraged. So just something to bear in mind for sure. The other thing I just want to quickly say is, because we spoke a lot about technology, but just kind of bear in mind, if we think about where most of our technology comes from, the people who are making our technology, the people who live in Silicon Valley, all of the people, the Apple people, all of those people, they have made informed decisions to send their kids to tech-free schools. So that's important to keep in mind. That was made for a reason.
So, and then with respect to our time, we're running out, and so I'm not going to go through all the details of this, but this is the step care approach to mental health and addictions within Eastern Health, which is the organization that Hazel and I both work in, as we mentioned. So as you can see, when people are presenting with mental health issues, automatically a lot of people assume that they need to have a specialized service, they need intensive therapy, they need an inpatient admission or whatever. And what we know is that there's many steps that you go through before you actually get to that point. So there are a lot of opportunities for self-managed care by recommending, and as social workers we can do this or to our colleagues and to families, that people can use helpful websites or apps we're going to reference the Bridge the Gap app, which was created by our local program here, Bridges. And I know we sound like we're contradicting ourselves now because we're recommending technology to help you deal with the issues, given to you by technology sometimes. But this is a situation where we're saying if you're going to use it and you can use something helpful on it, then you might as well do something that would help you. The other thing with regard to self-management sometimes is just using a crisis line where in that moment somebody might just need to talk to somebody about a particular issue. I'm not going to go through each of these, but basically as you go down the line from a single session to skill-based group to intensive therapy, you can see the layout there in terms of what people can benefit from when they have issues. I think this is our, so we have some time now for questions, if there are any. I think there's a few.
Thank you so much, June and Hazel. We do have a couple questions that have come in, and if there are others, you can feel free to send them along. We don't have a lot of time, but we'll try to get to them in the next couple of minutes. So the first question I had is back when you were referring to the amount of hours on screen time, is there any distinction made for what kids are actually doing on the tablet? So, for example, drawing and using Photoshop versus gaming or watching YouTube videos. So is there any allowance in terms of acceptable use of technology for these purposes?
So basically, using the recommendation is still a couple hours a day. Realistically, a lot of people exceed that. We know that once you get beyond the 5-hour period of technology usage through the day for children, you're running into serious problems, all the problems that I talked about, okay? And that would be the case whether you're doing, an intellectual game or puzzle or something like that, or whether you're doing gaming, okay? So it's the amount of time that matters. But if you choose to use the 2-hour period using games and puzzles and things like that, as opposed to like vicious gaming things or activities, then obviously the benefits are greater. So everybody is of the belief that the time is really important, but also if you're going to use it, the quality of what you're doing online is equally as important. And we know that when children are watching high-speed gaming programs, heavy-duty violence, all those kinds of things, we know what the issues are related to that. So, yes, using the kinds of things that you suggested would be better.
Perfect, thank you. Another question just in terms of could you repeat the amount of sleep for the different age groups? And tied to that question, someone asked if there was a recommended one for adults. I know the focus today is children, but
So for kids 5 to 12, it's been suggested that about 10 to 12 hours, which seems like a lot, but that's what they're recommending. Teenagers 13, 9 hours. So the 13 is a pretty tender age because there is so much growth in that year. And then 14 to 17, it's 8 to 10 hours. So studies are showing right across the country that teenagers are definitely getting less than the required amount of sleep. So it's 8 to 10 hours. And for adults, it's usually anywhere from 8 to 9. sometimes some sites and some kinds of information sources will tell you 7 to 9, but as a general rule, most adults need about 8 hours sleep. And as I mentioned before, a very small percentage, 1 to 3, and that's maybe being optimistic, percent of people don't need that much sleep. So hopefully that answers your question.
Okay, I think we have time for another question. In terms of anxiety, how much anxiety is normal, and how does one know when to get help?
Okay, so, well, first of all, I'll reference you to a poll that was done recently in a school, a local high school, where like 96% of students or something reported that they experienced anxiety. So that in and of itself speaks for the fact that anxiety is actually a normal emotion. We all have it, and we have it at various stages of our lives. As children, it's actually normal to have a fair amount of anxiety because you're acquiring new skills. So you haven't lived life long enough to have the acquisition of a whole bunch of skills that you need to survive. So every day is like a new experience, learning how to interact with people, learning how to organize your homework, learning how to go to your locker, learning how to, do all these kinds of things. So life in general can be somewhat stressful for children. So it's normal for teenagers, as an example, to feel uncomfortable ordering in a restaurant, asking people on dates, that kind of stuff. So when the anxiety is to the point where it's absolutely crippling for a long period of time, and I mean like not just a week or two or anything, but for a long period of time, and when it interferes with basic functions such as being able to eat and sleep and attend activities, attend school, those kinds of things, then it would be considered something that people really need to kind of maybe seek professional help for. So when a child just basically can't be a child, or a teenager just cannot live like a regular teenager, it doesn't necessarily mean that they're going to get medications or anything like that. They may still basically just learn all the skills that they need to learn, but they'll do it in a supportive environment. So normal would be, yes, everyone will have it, and then concerning would be when it starts to really impact your life. And obviously, learning exposure and that kind of thing helps to minimize that.
Oh, wonderful. Thank you both so much. And I think that is, I just scanned down through the questions. I think that's all the questions that did come in, which is perfect because we're right on the top of the half hour to finish. So just a couple of concluding remarks. I want to thank Hazel and June for their stellar presentation and for really sharing your knowledge, experience, and expertise with us today. The theme, as I noted earlier, for Social Work Month is bringing change to life. And certainly the work that both of you are involved in is a wonderful example of how social workers are bringing change to life, making positive impacts, and promoting the health and well-being of children, adolescents, and their families. And it's just wonderful when we can come together to celebrate our profession during Social Work Month, but also to learn from one another. As social workers, we are aware of the profound impact of mental health issues impacting on children and adolescents, and this session has certainly enhanced our understanding and how social workers are making a positive impact every day. So thank you, Hazel and June. It's truly appreciated that you could lead this webinar today, not only for our provincial social work colleagues, but also for our national social work colleagues. Again, the recording of this presentation, the slides, will be updated on the NLASW website and also the CASW website. For those who have attended at least 75 minutes or more of this presentation, confirmation of attendance is available now by clicking on the yellow icon at the bottom of your window. And I also encourage everyone to complete the evaluations that will appear on your screen. So thanks again, everyone, and have a wonderful Social Work Month.